Good afternoon, members. Welcome back to today's full council meeting. Can I remind all members to please mute your devices, particularly in the back corner? Thank you. Can I also remind members to please make sure microphones are in front of you when speaking to aid members who are struggling to hear what is being said. This is really important so that everyone has equal opportunity to take part in the council meeting. Members, we now move on to item 8, which is demographic and population change impact on social care. And I'd like to invite Jackie Pepper, Director of Integrated Health and Social Care and Chief Officer, to introduce the report. Jackie.
Thank you very much, Provost. Councillors, this report is brought to you today as the Integration Joint Board is facing the critical issues of unprecedented demand and complexity in social care and budget insufficiency to meet that demand. The Integration Joint Board is seeking support from the Council to manage the financial pressures in year, as the current budget is insufficient to meet the demand that has materialised. The Council's 25-26 budget very positively included £6.7 million to protect provision of social care, but higher than expected demand means that the higher level assumptions have been realised. Perth and Kinross is not alone, with IJBs across Scotland facing significant shortfalls. The IJB has delivered £12 million worth of savings since 2022 and is on target to meet a further £2.5 million by the end of March 2026 within this financial year. In addition, the IJB has depleted its reserves. This means that the actions to achieve further reductions that will not lead to service reductions and an inability to meet the needs of people currently eligible for support are now exhausted. The IJB is considering long-term and more strategic options which require consultation and impact assessment, and is seeking support in order to carry this out extensively and comprehensively. Appended to the report today is the Q1 performance report, which demonstrates the success of the IJB's strategy in meeting both national policy direction, whole system improvement, and addressing needs identified in the Joint Strategic Needs Assessment. So although demand for health and social care services is high, performance is strong, with reduced hospital stays and improved access. There's a correlation between that performance and the true cost. Ongoing transformation and service development are focused on further improving access and outcomes. While benchmarking nationally, Perth and Kinross is 29th out of 32 local authorities per capita spend for adult social work and social care. And in looking at Scottish Social Services Council's data, the latest report would indicate that we are the fourth lowest in Scotland in terms of the number of care home staff across all sectors per 1,000 people. So any change to this positive direction of travel and to the shape and configuration of service delivery is likely to have impacts across many parts of the health and care system. It's therefore crucial to consider this carefully and to avoid unintended consequences or irreversibly disturbing the balance we've achieved across our integrated services and to our social care provider market. A key message for the Council is that the IJB has demonstrated effective financial performance and good performance, but our population demands are set only to increase, placing further and enormous pressure on social care. This request enables the IJB to have time to scope out further recovery actions and develop a strategic recommendations. I and other members of the Health and Social Care Partnership Management Team are happy to take questions. Thank you.
Thank you, Jackie. First question is Councillor Forbes.
Thanks, Provost. Jackie, can you give us a summary of the IJB's reserves, where they were, say, a year ago, and why there's none left? And same question for the Council, I guess, for Scott Walker. Could we get a summary of our reserves, where they were a year ago and how much we've used up over the last 12 months?
If I can come to Scott first and then come to Jackie.
Thank you, Provost. So, Councillor Forbes, you've stolen my introductory remarks. I just wanted to quickly set out what the proposal within the report means for the Council's unearmarked reserves. So, our unaudited accounts showed unearmarked reserves at the 31st of March 2025 of £18.7 million. And that represented 3.7% of the Council's 25-26 approved budget. We've got known commitments from previous decisions of just under £2.1 million, which would have reduced our unearmarked reserves to £16.651 million, or 3.3%. So all things being equal, the proposal to allocate up to £4.180 million to support social care will reduce our level of unearmarked reserves to £12.471 million, or 2.5%. Whilst this is still within the limits of the approved reserve strategy of between 2 and 4%, there are still some key variables that may impact on the level of uncommitted reserves. For example, the additional costs of a bad winter or other weather events, costs relating to the Council's response to any unplanned events, and any other overspends that may emerge throughout the year. And I will keep the Finance and Resources Committee updated throughout the year as developments take place. Thank you.
Well, thank you for your question. Our reserves at the opening of 24-25 were at 3.6 million in earmarked reserves, and they're required for us to meet certain obligations, and they are often come very specific with specific outcomes to be met. At the opening of 24-25, the general reserves were sitting at 4.6 million. And we're now sitting at a position where we have earmarked reserves forecast for the end of this year at 1.5 million and no general reserves. I would like to add that in 2022 to the end of 24-25, £9.5 million of reserves have been required to balance the health and social care position. That helps.
Thank you, Councillor Donaldson.
Thank you, Provost. I'm not going to get asked about reserves, although there clearly is of immense importance in terms of council finances and how we go forward and for the budget process. But what I do want to ask, and it's primarily I think of Jackie, but may also be of Scott, is on the demographics. On page 255, we've got two graphs there. I think we've all seen other graphs too. But what I would like to ask is, it's good that people are living longer, but that presents challenges. In particular, it's the 85 plus age group and the cost of care at home, social care packages, but not just, it's for other, not just the elderly, but I think that's primarily focused there. Can I ask, just on terms of Scotland, the 32 local authorities, just how pronounced the position is in Perth and Kinross compared to other local authorities? The others I could think of in Scotland, but I don't know for definite, might be Dumfries and Galloway, might be Borders, might be Aberdeenshire, but because that's potentially got important aspects in terms of funding requests. Thank you.
Thank you very much, Councillor Donaldson. I'll attempt to answer your question, and maybe others who can add detail to that. My understanding is that ahead of the new projections that we received here, that we had the oldest mainland population in Scotland, and that's just set to increase. I think we would be looking to other areas such as Dumfries and Galloway to find somewhere else who's in a similar, some other local authority area that's in a similar position. The island authorities may be ahead of us in terms of the proportion of older people, but we're certainly up there at the very top in terms of the 32 local authority areas in terms of that projected demand. but the data is very often looking at 65 plus and 75 plus. But what we've provided here is to show what that means for the 85, 86-year-olds, because the costs increase substantially when you reach that age range, and that's across the board, whether that's healthcare, social care, prescribing, etc. So if anyone else has got any other information you want to add to that.
I can add just in terms of the general population, not specifically the over 85s that Jackie was talking about, but in terms of the national position, we are sitting at about 7th highest growth between now and 2032, with Midlothian, East Lothian, Glasgow, etc. above us, but 7th highest, and that's at 7% compared to the Scottish average of 4.4%.
Can I just quickly follow up? The reason I ask the question is, in particular with care packages, in particular for the over 85s, it is particularly pronounced here in Perth and Kinross. There is the request from COSLA for funding from the Scottish Government. How much of that can be met, I'm not sure, but for Perth and Kinross, it's disproportionate impact on us with older sections of the population, and we need to be able to give that proper care and provision for those citizens. Thank you.
I think you've summed that up very well, Councillor Donaldson. Thanks.
Okay. Elian.
Thank you very much. We've just heard in a previous question that we're really close to our minimum reserve level, and we're not the only local authority in this position. And if we're going to continue using the IJB model, the Scottish Government needs to take a look at how they're funded properly, because we end up in this position nearly every year. Chief Executive mentioned in an earlier response to a question that we don't have the funds to support all the demands on the council, and we're not going to have next year, and we're going to make difficult decisions. This means reserve will be used even more, and we'll end up like the IJB and have no reserves. And this is not a position we should find ourselves. What would happen if we didn't agree to the additional funding that's been requested? And what other alternatives are there? And what discussions have or will be held by the leader of the council with the Scottish Government to demand that sufficient funding is available so that the IJB can provide the ever-increasing demand on social care, as this top-up from reserves is not sustainable?
Jackie, I believe this is with you.
In terms of impact of if there was no funding agreed, the performance that was set out in this report would actually reverse, and it would reverse very quickly. And what that would mean is that some of the questions that we've had earlier on about very difficult circumstances that people find themselves in, that would happen more often and more frequently. So we would see people being delayed in hospital. Those numbers would increase again. The inability to provide care packages for some of the most complex individuals would arise, and so the failure demand, if you like, right across the whole system is something that would impact quite quickly. I don't think it would take too long to achieve that.
So I take it from that answer that there's no recourse to the Scottish Government to fill in the funds that we can't provide from reserves.
Chief Exec.
Thank you, Provost. It was just to highlight that conversations have been ongoing between COSLA and Scottish Government. I won't speak for the council leader in terms of his own party, but the COSLA manifesto has set out an ask of the next Scottish Government for an additional £750 million towards health and social care funding. And it was certainly one of the things that was highlighted at a recent COSLA meeting when Councillor Barrett highlighted that as one of the key financial asks.
I am coming to Councillor Robertson with a point of clarification, but on the assumption that Councillor Drysdale's is in relation to this specific point, I'll take his first, if that's okay. Councillor Drysdale.
Thank you, thank you, Provost, and thanks, Councillor Robertson, for hanging on a little bit longer. Just to confirm, and following on from what the Chief Executive has said, there are efforts underway to meet with both the Cabinet Secretary for Finance and the Cabinet Secretary for Health and Social Care in early course. As has been set out by Jackie, we are far from alone in the situation that we're in, and it's clear that something significant has to be done, and I will be vocal in asking for that when the appropriate forum takes place.
Okay, thank you.
Thank you.
Councillor Robertson, thank you for your patience.
Thank you, Provost. It was in response to what Mr. Walker said, about the finance settlement from the Scottish Government. Is that not reflected on our population, both current and projected? And so if our population is increasing, surely our settlement should be increasing accordingly.
So our funding is based on what's called the GE or grant aid assessment, grant aided expenditure assessments. Those are formula driven. There's a number of factors that look into that: rurality, poverty, deprivation, number of people over a certain age. They all feed through in terms of our funding solution. It does take a number of years for it to come through. The other issue is that there is a proposal on the books just now to review the methodology around some of these indicators, and some of these indicators impact on this particular area. We don't know yet what the impact of that will be, but we're watching with keen interest as to the impact, and we'll not know that until we actually get some detail through local government finance circulars, etc.
Okay, thank you. Councillor Braun next, please.
Yeah, thanks, Provost. I've now got two questions. Do you want me to split them in?
I'd like you to take both now, please.
Okay, so the first question, follow on from Councillor Bailey Ahern's point. Obviously, we're utilising some reserve, which will bring it down to 2.5%, you said. The budget is what, about 3 months away. I appreciate it's probably a little bit difficult, but what is the knock-on effect for our reserves then? Because as you know, in many of our budgets, we utilise some of our reserves. So is there a danger there that that will restrict what can be done in various the final budget decision?
Absolutely. There will be less money in reserves in order to use on a non-recurring basis. At 2.5%, 1% roughly is about £5 million now. So 0.5% means there's only £2.5 million before we get to the 2%, which is a limit that the council has set as the minimum for its reserves position.
Okay, thank you very much. And the second question, more general one, perhaps for Jackie. In the report, it mentions obviously that the IJB is going through a recovery process to obviously change how it works. And also there's mention that there is a ever increasing complexity of need for people. So my question is, are we in a situation where the increase in complexity month to month, year by year, will increase or outweigh the recovery that's being done, and therefore we will find ourselves back in a similar situation, maybe not next year, but the year after? The actual complexity that people need can outweigh whatever we can do to recover the IJB's operations.
I think the straightforward answer to that would be yes. We have had a series of transformation programs underway, and the one that I would exemplify here would be a 5-year transformation in relation to complex care, particularly in people with complex learning disability needs. So within that, we've been able to, in terms of the final report that came to the IJB just earlier this year, demonstrate that the arrangements that we have are able to support more people at a slightly reduced cost. So the average cost has gone down. So we've taken those approaches to reach that stage, but there's only so much that you can do around that. And I think we do need time to be thinking around what are the things that we need to do strategically and very long term. And to consider that very, very carefully and sensitively. We have looked across the savings plans and transformation plans across IGBs in Scotland, and are not finding much to learn from that. But we certainly need to look beyond perhaps Scotland and further to see what we can learn. So we need time to do that, and we need time to scope that out.
Just a quick supplementary. I mean, are we in the situation where we will have to prioritise the services the IJB offers, and some will have to be put back and may have to be shunted out effectively?
I think that's what plan part B of the recovery plan is trying to scope out, and that would be to restrict or reduce or change the way in which that's delivered. So that would actually contract the amount of service that we're able to deliver, but what that will do is increase a level of need, and those needs that we can't intervene in at an earlier point are going to escalate and increase. And I think Zoe articulated that in an earlier report, where if that builds up as it did during COVID, what you end up with is further down the line in terms of 2-3 years, much more complexity of need and demand to meet. So it's actually a disincentive to do that.
Thank you. Councillor Allen.
Thank you, Convener. My question kind of follows on, really. You shared, Jackie, that earlier in the year when we had the budget setting, you had reserves. And then here we are, October going into November, we have no reserves, and we have a further requirement for 4.43 million. That in itself will wipe out most of the council's reserves. Now, my adage to that is, what are reserves for? And I would suggest that they're for emergencies, probably something like this. So in as much as I understand that, I'd like to understand what your confidence is about that 4.43 million requirement right now. Is it going to escalate? What do you actually need? That's what I'd like to understand.
Thank you very much for that question. I'm going to hand over to Donna Mitchell, Chief Finance Officer for the IJB, but really just to say to you that we are monitoring this very, very closely, and in fact on a weekly basis to see what the recovery actions that are set out in Part A of this plan are achieving. And Donna might be able to say something in terms of where we are in month 6, because this report was produced at month 5. Thanks.
Thank you, Jackie. I'll firstly give a bit of clarification about what I'd meant around the reserve, so I've maybe confused the situation. At the start of 24-25, we did have general reserves of around 4.6 million, and that's around the 2% level, and that's the IJB's minimum targeted level of reserve, and they had held more than that level of reserve since just after COVID, actually. So it certainly wasn't the ambition of the IJB to use that reserve funding for core services, and like what you said, it was absolutely there for unanticipated costs and emergency situations. Unfortunately, we were finding ourselves in order to deliver statutory care, we required the reserves to balance the budget. So from the period of 2022 to the period of 24-25, significant IJB reserves have been used to just balance the budget. Therefore, at the end of 2024-25, coming into this financial year, we had next to no general reserves left. Therefore, obviously the application was made to the council as part of the budget setting, identifying on a medium level scenario of need that we were anticipating that we would require 6.7 million, which is what the council awarded as additional funding for health and social care for social care for 25-26. What we're finding ourselves in now is that higher level scenario that we did anticipate, but we hoped wouldn't happen financially. And that was around £5 million we anticipated that additional cost to be. And that's where we're finding ourselves now, around that high level scenario. And that's the figure that you're seeing in the papers today. Confidence about whether that's going to increase or not, that obviously is entirely based on what people require, and therefore what we statutorily need to provide and what we need to continue to provide in a prevention situation as well. However, having seen early sight of the month 6 figures, so like Jackie said, the figures just after this report, I feel somewhat assured that the recovery actions that have been put in place are helping to to perhaps not reduce it, but minimise any further increase.
So, yeah, so rather than medium, we're at the higher end. Yeah, 4.43 seems quite specific. And my question was at the outset, what do you really need? Is it going to be 4.3? Is it going to be 5? Do you think it's going to be higher than that? I get what you're talking about, levels of confidence on month 6 or period 6, but we've got some difficult decisions to make as a council when it comes to budget setting. I'd like to have a better understanding of what this number actually needs to be, if you can do that.
I'm sure you're aware financial projections are just that, and they're based on the expenditure that we know of, that is actual expenditure up to a certain point in time. We have strong relationships with our services. We know what their intentions are and the level of need that they're seeing come through. But unfortunately, if they have statutory obligations to continue to meet, to keep people safe, they're unable at the moment to not provide that. Therefore, if the need is beyond what we anticipate it to be, the costs will go up. What I am saying though is from the latest actual expenditure that I've seen come through in the month after this report was finalised, I'm not concerned that it's going to continue to increase at that point.
Councillor Peter Barrett.
Thanks, Provost. There's just a couple of things I want to say in response to what Mr. Walker said about the GEE indices, because this was news that we only got this week, and that is that the care at home and home care indices haven't been updated in terms of population trends, and that the Scottish Government's been working on data that was from 2001 census data, not updated in 2011 or 18. So although this financial challenge that we are looking at here right now is a really big problem. The impact of correcting the incorrect mathematical formula that was applied to those statistics and the out-of-date statistics puts it into a cocked hat, and authorities could be benefiting by, I think, up to 47 million or losing out to the tune of 30 million. So the 4 or 5 million pounds that we're confronted with here today could be completely swamped by the impact of how that's worked out, because I don't think it's sustainable to say that we would continue to work on data that we know is 20 years out of date and a formula that is incorrect. So there has to be some sort of correction to that, and behind that there's also a move to take greater account of deprivation within that distribution, and what that means to Perth and Kinross, where we've got rural issues. And I don't think that there's any move, and maybe we can agitate for that for the over 85 or the elderly population to be factored into that formula, because otherwise we could really get hammered. And I think Donna kind of touched on I think what is partly central to the situation. I think we need to put our hands up to a certain extent as to where we got this wrong as elected members or through the budget process. I think that maybe hanging on to the mid level scenario was too much optimistic thinking. I'm certainly aware that there was pushback in terms of the pressures that the IGB put forward, and in accepting that, then that kind of meant that there weren't an awful lot more hard decisions that we might have to take in this year's budget. So I'd like to ask Mr. Walker, has he considered, how IGB pressures and demographic trends, need to feature within our medium-term financial plan, and is he satisfied that that process is robust enough, or is it a case that it's the budget review process that needs to be enhanced to avoid this sort of mid-year scenario coming back to us again? Yes, sorry.
So I will be reflecting the most up-to-date population projections in the medium-term financial plan that I'll be bringing to council in December. They only came out a few weeks ago, so it'll be hot off the press. I have shared confidentially with budget review groups the implications of the latest IGP projections in terms of the council's previously balanced budget position. We need to understand what these changes to the calculations are going to do. Any calculations that bring in deprivation tends to make Perth and Kinross worse off. So we'll not get that level of detail until we get the Scottish Government budget through in January. It is later this year, I think it's the 13th of January, and we'll see figures following that. And so at that point, we'll get a bit more detail as to whether these figures are following through, what are the consequences of these changes, etc. But we will be keeping it under review. Myself and Donna work very closely on these issues. And as I said earlier on, we'll be bringing regular updates to the Financial Resources Committee, and I'll be keeping budget review groups up to date as well.
Thank you. Councillor Duff, you have 2 questions.
One of them has already been answered, so I just have the one, and it's in relation to page 258 of the report. Sorry, just come off my screen there, which talks about the financial recovery plan, and at paragraph 7.2 it talks about part B, sets out more strategic options which include reviewing commissioning models and eligibility criteria. Most of these long-term measures will require comprehensive impact assessments and the completion of necessary consultation required to deliver major service change. And my question was really, how quickly can that assessment work and the consultations be undertaken? And can the council provide any further assistance in getting this work completed as quickly as possible? Thank you.
Thank you very much, Councillor Duff. I think I'll take your second part of your question first and say any assistance would be gratefully received. And that we are ensuring that we have contributions to that assessment from council services, from health services, from the third sector and our commission providers. So, so I suppose the first thing to say would be this is going to take a bit of time to be able to do that, but we're committed to taking back a high level assessment of these options to the IGB in December. Much of this would be considered to be major service change if there is approval to take that forward, and therefore we would be obliged to take forward planning with people guidance, which is Scottish Government guidance, and we would have to apply that. If we didn't do that, then there would be a challenge to any decisions that might come forward as a result of that. So in short, it's going to take a bit of time to do that, and so therefore anything in Part B is unlikely to result in any significant reduction in our costs within the financial year. I hope that answers your questions.
You, Bailey McLaren, next, please.
Thank you. I don't suppose any of us actually anticipated we'd be here today discussing this. Well, we had hoped we wouldn't be. Jackie, I know that everybody involved in this is working really hard, and it's a horrible position for everyone, for all of us. Many of us in the room have family members who I've had benefited from this care. Certainly know I did. The words crisis, urgent, everything, these words are being used. Are you calling Mayday? Is this Mayday?
My professional answer to that would be that if you look at the performance that we're achieving, that there's very good work going on at the front line. And we can demonstrate that in lots of reports that have already come forward in terms of the work that's being done. So I would need to give you some reassurance around that. However, I think if you look at the performance report and you see what's been achieved and some of the things that are beginning to change around, for example, sickness levels rising across both our health and social care workforce, just ever so slightly. And just even in the iMatter report, which looks great, is just slightly down. So I think that is telling you the stretch that's across the workforce at all levels. And there's also, I think, a very tight stretch in terms of the management capacity that we have to deliver on the significant change that we have here. So that's going to be an issue. So not quite Mayday, but I think we're close to it.
Thank you. Deputy Provost.
Thank you very much. The decision before us today is about the short term, but we are rightly, obviously, very concerned about the longer term. And from the briefings that we had, I know population projections can change over time, but in the near term, I think they're reasonably accurate. My estimation was that we have a 500 people per annum increase each year in the over 75 population. And we also heard what the average cost of a care package is. My question would be what percentage of the over 75 population in Perth and Kinross actually do require a care package? Because I think we can fairly readily come to an estimation of how much additional funding over time is needed, if you like, all other things being equal in terms of provision and costs. Thank you.
Thank you very much, Deputy Provost. That's something that we've been looking at with the original projections that we had from the 2018 census, and something we need to update with the revised data around that. But I know that particular finance colleagues, and Donna, you've been doing some work in relation to the additional cost of that progression of the older population through the age range. So in terms of predicting that to was it 2028? On the original projections, we estimated that to be an additional £6 million. But we'd need to revise that for the current populations. We don't have that to hand, unless Donna's been a wizard and done it overnight, and I don't know anything about it.
Sorry, I was just going to add, we are actually working on it, so it's not quite complete, but it is being worked upon. The other thing to take note of, it's not just about the number that's increasing. So the 6 million that Jackie talked about, that was us looking at the number of people that will reach that age and a cost to that. But what we're also seeing is that there's a change in that person. So that cost is changing because there's a complexity to that cost that we didn't necessarily see before. So that one individual may not just come with that simple cost addition now. It might be a different type of cost because there's a complexity that wasn't there before.
Thank you very much. Councillor Lane next, please.
Thanks, Provost. Yeah, this is really concerning to everybody here. And my concern is that when we're setting a budget, we aren't being absolutely realistic across the field, and then we're making decisions and having to change them in mid-term. Maybe we can learn from this and actually go for the higher range on something. If something goes up 6% one year, you would expect it, well, it's still in year, that 6% is actually up to about 10% now from what we've got. So I think, talking on reserves, we were at, in 2022, we were down at 2%, and we've built them back up, but we keep, this is something that's really important, another 4 point whatever million. And then you look at, we're paying 3 million to take down a hotel as well. So where moving forward, we're going to have to look at where our spend should be. What I was wanting to ask for is about the population. If the population is rising, do we have any information of what age the people that are going to be coming to Perth are? Are they going to be of young, that will make the over percentage population of people over 75 less because it's families that are moving in here and bringing the age down, and there'll be more income from council tax, etc. And I would like to have a look, is it possible to get the spend of the IGB across age groups, like for 0 to 10, 10 to 2020, because we just keep talking about older people, the cost going up because people are getting older and they've got more complex needs. But we seem we'll have more people of a younger age who have more complex needs as well. So it'd be interesting to see that rather than, you know, hanging everything on the fact that people are getting older and living longer without being able to see the range of spend across various cohorts of the population. I just wonder if it's possible to have a more in-depth look at that across the population.
Donna can provide some response to that.
Thank you for your question, Councillor Lang. In regards to the age group, we have had a look at the information that came out, as Scott Walker advised us a couple of weeks ago, and we do have some breakdown of the age group changes that are expected. For our, quite positively, the numbers in the working age population is expected to rise over the period that's been predicted from 2022 to 2047. However, when you look at the proportion that is of our total population, unfortunately that doesn't change. So we've had a look at the age range between 26 and 49, so that key working age population, and yes, the population numbers are expected to increase. But at present, it's 27% of our total population in Perth and Kinross, and that 27% is not expected to increase. That proportion's meant to, or is predicted to stay the same. Whereas when you look at the 75 plus age range, obviously the numbers are expected to increase, but the proportion of our total population in that age range is expected to increase too. So going from 12% of our population, our 75 plus just now, that will increase to 19% of our population in the end of that period. And for the other part of your question, we can absolutely give the cost by age when we look at 18 to 64 and 65 plus. But yes, we could look at a more in-depth analysis around ages between the categories.
Okay, I think the more data and information we've got, the better decisions that can be made when it comes to setting the budget, because we looked at 9.5% council tax rise last year. Well, most of that will equate, or at least 8% equates to the extra funding that's had to go to the IGB, and like the members will have to make informed decisions of where they want to spend the funding moving forward. So the more information we can get, the better. Thank you.
Okay, thank you. Councillor Cuthbert next.
Thank you, Provost. My question relates to two of my favourite subjects, which is population increase and the GAE allocation through the Green Book. See that Scott's smiling there. Basically, my understanding is that the population of Perth and Kinross has grown by 11.86% since between 2001 and 2022, and Scotland's by 7.46%. So there's a 4.4% differential. On top of that, I'm not sure how much we are looking at and challenging the figures in the Green Book. So, for example, Perth Harbour for 24-25, we've got £121,000 allocation, but this year we've had zero allocation for the harbour, even although I believe it's still a harbour. So I don't know how much we're challenging. My question relates to the influence that we can have over what goes into the Green Book, and how that can be achieved. Is it through COSLA? Is it through council? Is it political? How do we influence it? Because it strikes me we should be asking for a retrospective payment over the last 20 years to account for the fact that we're out of sync with our actual population. So I'm just wondering who can answer that for me.
So I think you've almost answered your question yourself. I think it's all of them. I think we can use COSLA to lobby. There's a group of directors of finance called the Settlement and Distribution Group. Those are a number of directors of finance. I'm not on that group, but I get copies of their papers, so we're able to influence that way. I think we can use COSLA, who are actually asked to endorse the proposals and changes and methodologies, etc. So I think we just need to use all of the tools that you mentioned in order to do this. But I mean, we will not be unique in this position. There'll be a number of councils who are experiencing significant population growth that is not reflected through GE. So I think I need to take it forward with heads of finance, and possibly through Councillor Drysdale through COSLA.
Thank you. My point really is can we have a plan of how we're going to do this to try and address it? Because you said in the introduction that there was the question of poverty becoming more significant, therefore our GAE allocation dropping. So how do we influence it that it's actually also looking at the age of the population and current or projected rather than historic?
So I don't know how much I can influence it. I can certainly start lobbying my colleagues, start that conversation. I don't know whether that's something that Solace would be interested in, throwing a hospital pass to the chief executive. But yeah, I think we just need to use all of our forums in order to get this conversation started, because there are a number of councils that are in a similar position. The other issue we've got is when it comes to the local government circular settlement, there's the floor. Now that protects councils where there is population reductions, and we tend to suffer from that position. So there's a lot of calculation involved, but we can certainly start the conversation.
Provost, if I may return, just to say I would welcome a paper at some point to some committee just outlining how we are approaching this, whether that be by way, all the different influences we're trying to put into place, just so I understand, because I think this is something we need to look at.
The chief exec can maybe pick that point up when he provides his answer.
Thank you, Provost, and thank you to Mr. Walker. I'll remember that. Yeah, I think there's a number of places where this conversation needs to be picked up. Clearly, we're having this conversation here within council. There's a conversation to be had at a Tayside level, because the position across health and social care partnership is quite different across Tayside. So we need to continue to have that conversation with our colleagues in NHS Tayside about what integration means, and that kind of that flow of resources into community-based settings. But that's said with the full knowledge that fundamentally there's a question about the overall level of resourcing in the health and social care system at this point in time. We will continue to pick this up. Solace are part of that conversation, and I know that there's a further Scottish Government and COSLA round table event on Monday afternoon regarding depopulation, which I'm invited to, and others maybe as well. But we'll continue to make that point, because the paper recently presented for COSLA, I don't think highlights enough of the cost of delivering public services to those in that elderly age demographic. It focuses on the rural-urban conversation, it focuses on depopulation, but the cost of services, and Donna and the team have done a great job in highlighting the increasing cost as people get older. That's not, in my opinion, necessarily reflected in the way it needs to be to allow us to deliver the services that we want for the people of Perth and Kinross.
Thank you, Councillor Cuthbert, for that pertinent question. I was disappointed though, because I was looking forward to finding out how car parks related to the paper when you said it was two of your favourite things. A very concise final question from Councillor Stewart, and I'm timing you.
Thanks, Provost. It's maybe developing on something that the Chief Executive just touched on in terms of the resource transfer between NHS Tayside and the Health and Social Care Partnership. Chief Officer and Chief Finance Officer, you included the performance report to demonstrate the high level of performance of the Health and Social Care Partnership, particularly in things like reducing delayed discharges, preventing admissions in the first place. It's maybe just to highlight that even though money is being saved within the health context, there's not that integration that the Chief Executive was referring to in terms of a resource transfer over to the social care side. And to demonstrate that point, I wonder if the Chief Finance Officer is aware of any health and social care partnership which has received large hospital set-aside monies. But for the benefit of elected members, you might need to explain what in 20 seconds what a large hospital set-aside is.
Welcomed your challenge, thank you. So large hospital set aside, in a nutshell, that is what we use within the hospital setting. So that could be our geriatric beds, our general medicine beds, our respiratory beds. And I guess the challenge for us to shift that balance is that the less of the beds that we use, because we put things into the community or keep people at home without requiring the services at that level, the bed numbers or the use of the bed numbers would drop, and therefore the resource could transfer into the community to allow us to provide care in the community that would prevent them going into hospital. So that very simplistically is what that large hospital set-aside mechanism was set up to do. I'm not aware of any partnerships where that has worked successfully. It may have some elements, but it's not anything I hear people talking about quite positively to share practice. I would add though, for Perth and Kinross, when we look at our 2019, so our pre-COVID bed usage of the geriatric, general medicine and respiratory beds, we were at a level that was fairly lower than what you're seeing now, and that did increase in 2022. So it increased up by about 13,000 bed days per year. Since 2022, that has been reducing, and over the last year, we've actually reduced our bed usage by around 7%. However, we're not anywhere near that 2019 level. So for money to actually be released from the hospital, we've not gone underneath what the starting point was. So we are seeing a positive performance in our usage of beds, but we're not below that level that we actually started out upon.
Thank you very much. That concludes the questions on the paper. I now invite the Leader of the Council to move the report.
Thank you, Provost. This report to Council sets out critical issues facing Perth and Kinross in relation to demographic changes and how this is driving unprecedented demand and complexity in social care, particularly for older adults and people with disabilities. Our staff and commissioned services are clearly showing skill and dedication to caring for our most vulnerable people and improving outcomes, and they must be wholeheartedly commended for the work they do every day of the year. The Integration Joint Board is facing financial pressures within the current financial year and is seeking support from the Council, as it is clear that the current budget is insufficient to meet these needs. Nationally, IJBs face a £560 million shortfall. Perth and Kinross's share of that is estimated to be notionally 15 million. However, effective financial management and positive performance metrics have stopped that level from fully materialising. The Council's 2025-26 budget included additional £6.7 million, as we've heard, for social care, but higher than expected demand has created a further £5 million risk in this financial year. Meanwhile, the IJB has delivered £12 million in savings since 2022, making further efficiency reductions increasingly difficult to achieve. The IJB faces significant financial challenges due to this rising demand and complexity, and has approved a financial recovery plan which includes immediate actions to save just under £1 million across both health and social care. Without additional funding, service reductions would be unavoidable. Council support is essential to maintain safe and effective care for people who cannot live without it. The IJB is also considering long-term and more strategic options which require consultation and impact assessment. Comprehensive assessments will be conducted to evaluate effects on protected groups, carers, staff, providers and system performance. These will inform future decisions and ensure equitable service delivery. A key message for the Council is the urgent need to collaborate with partners and service planning based on the revised population projections issued by National Records of Scotland on the 30th of September. However, there remains a pressing need to ensure that the most vulnerable across our communities get the care they need when they need it, and the current situation underlines our shared priority to care for and protect vulnerable people. Our shared vision is for a Perth and Kinross in which everyone can live life well, free from inequality. And to ensure we realise this vision, it is important that Council supports the recommendations in this report. That's what my report says here. What I want to add to that from a personal perspective is the reason I came into being a councillor was because I care passionately about this area of work in particular. And I said earlier in response to Bailey Ahern that I will be vocal. You bet I will. These are the papers for COSLA's meeting on Friday. I'll just read 2 or 3 items from the agenda. Local government financial viability update, health and social care finance update. And then it goes on to talk about reduced class contact time, etc., etc., etc. But in terms of what we're talking about here today, it is vital that we properly fund social care if we are the local authority that we want it to, that we want to be. I have in one of my many WhatsApp chats with the leaders of other authorities around the country. There is a lot of talk around the country about the problems and the financial shortfalls that other local authorities are also experiencing, and they are talking about the potential need for increasing what is already an uncomfortably high council tax requirement by up to 5% just to fund social care. So this is, as I said, that this was used, a critical issue. It certainly is, and you can be assured that I will be making Perth and Kinross Council's position completely clear on this, that this needs to be resolved by funding through national governments. Thank you, and I move the report.
Thank you, Mr. Leader. Councillor McCall, you have just under 4 minutes to second the report.
Thank you, Provost. I don't think I'll take 4 minutes. Firstly, I would like to say that I welcome that this report is brought before us today for our consideration. As we've heard, the financial position in the current year is largely due to new demand with higher complexity of need, and it is likely that with our projected population growth that the demand and services will increase further. Appendix 1 of this report provides some of the key performance measures that our service delivery is measured on. Of particular note is that out of the 32 local authorities in Scotland, Perth and Kinross is one of the most cost-effective service delivery models, with only 3 other councils performing better. This, along with other statistics and data provided in Appendix 1, demonstrates a commitment to financial efficiency while, so far, avoiding substantive change or reductions to service delivery. However, notwithstanding ongoing financial prudence and striving for continuous improvement, the Health and Social Care Partnership and the IGB, like all service areas of the Council, is facing challenging times financially. And I recognise that difficult decisions may be required in the forthcoming budget processes, and that careful consideration will have to be given to how we deliver services, specifically adult social care services, in the future. I welcome that the IGB is committed to carrying out a strategic review of service delivery models, eligibility criteria, as described in clause 7.2 part B in the report, the outcome of which will in turn inform our budget considerations for future years. But in the interim, and pending the outcomes of this strategic review, I feel it is incumbent on all of us in this chamber to do everything we can to ensure that we continue to provide the best possible support and services to those in our communities who are the most vulnerable and with the greatest need, and crucially, to those who care for them. Therefore, Provost, I am pleased to formally second this report and commend it to my councillor colleagues. And I further endorse and agree with every single other comment that Councillor Drysdale made. Thank you.
Thank you, Councillor McCall. I have an amendment from Councillor Peter Barrett.
Thanks, Provost, and I sent the amendment to committee services, so they should be able to share it on the screen. And perhaps in light of the comments made by Councillor Drysdale in response to the question and answers and part of his proposing speech, the amendment might be redundant, but I think it's probably still worthwhile committing it to black and white and paper. We've heard that Perth and Kinross Council isn't alone in facing real financial challenges in social care, particularly care at home and care for the elderly, as detailed in the report, and the £4.18 million overspend confronting the council this early in the financial year demonstrates the severity of the situation here and with IGBs up and down the country. We've heard that there is a £560 million shortfall with providers of care in precarious financial situations and a recruitment and workforce crisis compounding matters as well. So I think given that serious background, it is deeply worrying that the Scottish Government has failed to meet with COSLA last month and then cancelled a subsequent meeting to discuss the challenges and threats to the viability of the sector and providers for a second time. And I'm pleased that the Chief Executive has more up-to-date information than I had, that there is to be a roundtable meeting on Monday. I think maybe ministers have been too busy preparing for their party conference and conjuring GPs out of thin air to staff phones and accept walk-in patients as yet unbuilt doctors' surgeries than they have to considering the crisis of care at home and home care. And the image of Nero fiddling while Rome burns springs to mind. Provost, it is clear that we can't rely on our case being responded to sufficiently through national channels, and I think the evidence in this paper demands that it is pressed urgently and directly. And given that our council area covers the First Minister's constituency, I would hope that we can count on him to help facilitate access to his cabinet secretaries to listen to our case. So I would advise the Leader of the Council that in addition to the amendment that I've proposed and his commitments, that we also press John Swinney's buttons, because the impact on service delivery and the impacts on both local and national outcomes and priorities, if we have to go down the route of Part B, then that will be, to be blunt, it will be a mayday call. It won't be a maybe call, because I think if you look at the impacts that tightening eligibility criteria will have, operating a care at home and care package waiting list, prioritising services only to those in the greatest need, capping the cost of care at home packages, all of these will have a huge and damaging impact on the people we currently care for and for their carers and families, both now and into the future. It will turn early intervention and prevention upon its head, making them virtually meaningless concepts and the aspirations of a bygone age. It will take us back to the BS era, and before you think that's anything rude, I'm talking about before Salmon, before Sturgeon and before Swinney. And that's just the serious and significant consequences of the Plan B items that are actually detailed in the report, but the impact beyond those measures of what would be required to make the extra £3.75 million would be absolutely horrendous. Now, I don't for a moment think, despite what has been said in this chamber, that when we hear about the impact and the equalities impacts of the measures that are contained in Plan B, we're going to touch them with a barge pole. There will be hardly anything within that we will actually actually as a council want to do. So, you know, I think if there are efficiencies that can be driven in the IGB, and I'm pretty sure there are, I think we need to look at how we modernise the delivery of care packages on the ground and the logistics around that as well. But again, there isn't going to be a huge amount of money in that, you know, so I think we really need to face up to the significant investment that is required both by us as a council, but crucially from the Scottish Government, because we cannot just keep on moving budgets from out with social care into social care at the expense of all the other services that we provide. Thank you.
Thank you, Councillor Barrett. Bailey McLaren, you have about 5 minutes.
Provost, thank you. May not need 5 minutes. Provost councillors, we're all aware of the urgent financial pressures associated with particularly the Health and Social Care Partnership. These pressures are reflective of the high level of ageing population of Perth and Kinross, which is captured within the findings of the Scottish Census of 2022, and as we have heard today, previous census. As Jackie has said, the oldest mainland population in central Scotland. So now it's officially acknowledged, yet we must wait until 2027 for the associated funding uplift. Why? The ongoing increasing costs towards Health and Social Care Partnership have fallen to the Perth and Kinross Council budget to plug the gap. If this continues, other service budgets will continue to be cut, or should I say slashed. The very least we can do for those currently receiving care at home service and those with the complex care needs packages is to challenge the Scottish Government. As we have heard, the demands are not forecast to decline. Simply, these vital services need to be future-proofed. This additional funding is now needed, as the data shows. I am happy to second this important amendment.
Thank you, Bailey McLaren. I have a point of clarification from the Leader of the Council.
Thank you, Provost, and thank you to the mover and seconder of the amendment, which I'm more than happy to accept into the motion. What I will say, first of all, is I do enjoy your speeches, Peter. They do make me smile sometimes, so thank you for that. But and what I would also add is that I'm ahead of you. I have spoken to the First Minister already about this, and about the need for this meeting with the Cabinet Secretaries directly responsible, and so that is being facilitated as we speak. So there will be that dialogue, and in the meantime, if Council agrees this motion, I am of course more than happy to write as directed in the amendment there. I have to say, in all honesty, that while doing so, we've all heard in terms of the situation for the current year budget, it may be very challenging to get any movement there, but I will try. And in terms of the future budgets, absolutely. There needs to be increased funding for social care across the country. But what I would say as well, and you would expect me to say this, but I believe it, that the Scottish Government is limited in its finances by what it receives from the UK Government. And that is an important factor to be borne in mind. But nevertheless, as I said at the lectern, this has to be top priority, and I will make sure that it is. Thank you.
Thank you. Councillor McCall, are you also happy to agree to incorporate? Wonderful, thank you. Councillor Duff first with a comment.
Thank you, Provost. This is a very sobering report about the financial pressures and future costs of social care in Perth and Kinross. We've already heard that Perth and Kinross Council currently receives the 4th lowest council settlement per head of population of mainland authorities, and we've also heard about the projections for Perth and Kinross in future years of residents in the 68 and over age categories, and these are considerable. I think irrespective of our decision today, this issue isn't going to go away with a further injection of 4.2 million. I concur with Councillor Barrett's comments about the age of the data being used to calculate council needs and the Scottish Government formula to arrive at these settlements. And this must be addressed, and a more informed and equitable share of government monies need to come to local authorities. I listened to what Councillor Drysdale said there about UK government money, but I think if he looks at the council's, local authorities' share of Scottish government budget, the percentage going to local authorities has decreased considerably over the years, and that needs to be overturned. Can I just finish by saying that I therefore welcome the amended and the comments of both chief officers, and also any discussions that the council leader and COSLA will have with the Scottish Government in getting all local authorities, especially Perth and Kinross, a better settlement in its forthcoming budget. Thank you.
Thank you, Councillor Duff. Councillor Lane next.
Thanks, Provost. Yes, I support the amendment, maybe not all the sentiment and the spiel that went with it, but I think we should be, as a local authority, channeling our resources to ask from every possible source to get better funding from Perth and Kinross. Earlier on, I mentioned about the fact that UK government, I was trying to keep UK government out of it, UK government policy on immigration could have a massive effect on our ability to deliver health and social care and care at home. And I actually asked if somebody would second an amendment, because I know that everybody in the chamber likes to write a letter, and I was going to get a letter, but I couldn't get somebody to second it. So I welcome asking the Scottish Government and trying to drive forward to help Perth and Kinross fulfil everything that we want to fulfil. But I would also like that at times we can put this aside, all the politics of it, and actually go and get funding from whatever source we can. Thanks.
Thank you. Councillor Illingworth next.
Thank you, Provost. In February, the IJB agreed a revenue budget of round about £300 million. Since then, we've been hit by a deluge of complex and expensive cases to look after. But even so, the budget is only out by 2% so far. So I'm happy with that. Although, given that it has enormous consequences, given the multiplier effect.
Okay. Councillor Massey.
Thank you, Provost. We're facing a moment of reckoning. This latest report lays bare the scale of the challenge. Our population is ageing faster than the Scottish average. The number of residents over 75 has already increased by 10% in just 3 years and is projected to rise by 12% next year. This is not a future problem. It's here, now, and accelerating. The consequences are clear. Demand for social care is rising. The complexity of need is deepening, and the financial gap is widening. As elected members, we must ask, how do we balance fiscal responsibility with our duty of care to the most vulnerable in our communities? I support the recommendation to allocate up to £4.18 million from the unearmarked reserves this year, but I do so with expectations that we have transparent reporting on how this funding is used, full involvement of elected members in any changes to eligibility criteria, a robust equalities and fairness impact assessment that includes the voices of service users, carers and providers, and a clear plan for long-term sustainability, not just short-term survival. Finally, I want to acknowledge the workforce. They have delivered exceptional outcomes under immense pressure, but they are not immune to burnout. We must protect their well-being as fiercely as we protect the budget. This is a significant moment. We must respond with leadership and ensure that Perth and Kinross remains a place where everyone, regardless of age, ability or circumstance, can live well. Thank you.
Thank you. Councillor Rebeck now.
Thanks very much again, Provost. It was just to underline my support for Councillor Councillor Lane. His comments earlier on about UK policy to immigration, I think it might get in the way of all of this recovery. I was unaware that he had a potential amendment. I think it might have been something I could have spoken to or seconded, but just to underline my support for Councillor Lane's comments earlier.
Thank you. I see no further comments, so I'll now move to the Leader of the Council to say anything he wishes in summation.
Nothing further to add, Provost.
Excellent. Thank you very much. Members, can we agree the revised report? Great. Thank you very much. Members, move on to item 9, which is the ALIO's Review Options Appraisal 2025. And I'm going to invite Charlene Guild, Strategic Lead for Projects and Programmes, to introduce the report.
Thank you, Provost, and good afternoon, members. I'm pleased to present the findings of the ALIO Options Appraisal Review, which forms part of the Council's wider transformation and change programme. These papers represent the results of a significant body of work undertaken over the past year, with contributions from Council officers, ALIO chief executives, external consultants and elected members. The purpose of this review has been to assess the current structure and performance of our arm's length external organisations, so Culture Perth and Kinross, Live Active Leisure and Perth Theatre and Concert Hall, and to consider options for future delivery models that ensure sustainability, efficiency and alignment with Council priorities. This reflects our commitment to delivering best value, ensuring robust governance and supporting the culture, leisure and wellbeing outcomes that matter to our communities. The review is undertaken by ECOS Consultancy and Brian McLaren joins us online today. The consultants were supported by a dedicated working group comprising of senior officers from the Council and ALIO chief executives. It involved extensive engagement, financial analysis and options appraisal. The findings are clear and forward-looking. At this time, no structural change is proposed. However, the review identifies significant opportunities to improve collaboration, efficiency and sustainability. The central recommendation is the establishment of a strategic alliance between the Council and our ALIOs. This new partnership model will drive forward operational challenges on a project basis, including improved collaboration, joint services and procurement, workforce planning and operational improvements, ensuring that we continue to deliver best value for our communities. It is proposed that the Strategic Alliance report to full Council annually, ensuring transparency, accountability and progress. In addition, progress on previously agreed actions from December 2023 has been substantial, with most work streams now concluded or embedded into ongoing transformation and change activity, which is organisational wide. These recommendations are grounded in robust evidence and reflect our commitment to delivering high quality services, improving outcomes for our communities and ensuring our ALIOs are future proofed against the challenges we face. I'm happy to take any questions related to the papers. Thank you.
Thank you very much, Charlene. I have a first question from Councillor Liz Barrett, please.
Thank you, Provost. I know we as a council, since long before I was a councillor, at least 2018, according to this paper, have been trying to get the ALIOs to improve their financial stability and operational effectiveness and reduce the level of subsidy that's needed from PKC before this review was set up nearly 2 years ago. I think many elected members will share my disappointment today that it's taken so long for this review to conclude that it appears that little can be done. The recommendations we have in front of us at 2.1 ask us to approve the establishment of a strategic alliance among the Council and the ALIOs and progress of operational measures through further work in relation to efficiency savings and future sustainability through the strategic alliance model, and it refers to income growth, shared services and work workforce planning, which are in 6.2.2 of the main report. And there's no reporting back planned until October next year. Sections 5.2.3 and 5.3 in the report and 6.2.2 are vague on how exactly these will improve the funding position. Please, could we have confirmation that the work of the Strategic Alliance will include the measures set out in 5.3 that are referred to in 6.2.2 of the report, and that the Strategic Alliance will have clear aims and actions, and that this Council will see those actions and target performance indicators for the Strategic Alliance? Thank you.
Thank you for your question, Councillor Barrett. At this point in time, the Strategic Alliance has been a recommendation, and you'll see that we haven't actually agreed the terms of reference for the Strategic Alliance. It would be the view of the ALIO working group that actually the group should be responsible for agreeing these together. But absolutely, in terms of the financial stability and sustainability of ALIOs and some of the more innovative and creative approaches that we will need to take to make sure that happens moving forward, the Strategic Alliance should absolutely be responsible for that, which is why we're suggesting a project-based group rather than just an ongoing group for discussion.
I'm not clear what the difference between a strategic alliance and a project-based group is, and will we see those terms of reference, and if so, when, please?
Yeah, so I'm more than happy to bring these back to committee in terms of the terms of reference. They should be done early next year. In terms of the difference between a project group and a strategic alliance, I think they'll be one and the same thing. What I meant by that is they will work on a project basis, so they'll have very clear outcomes and objectives to be met with key milestones, and will be based around action and progress.
Thank you, and I think given the importance of it, it would be good to see those terms of reference when they're ready. Councillor Braun next, please.
Thanks, Provost. I'm on page 387. This is the end of the ECOS report, and it's to do with this question of utilities payment agency for VAT. I'm not sure Mr. Walker might be able to answer this one. PKC, as I understand, is a corporate entity in its own right, and all the three ALIOs also are corporate entities in their own right, or perhaps structured and formed differently, but they are separate. And I'm reading this, maybe I'm reading this wrong, but the concept here is that PKC would pay the utility bills and recover the VAT on effectively utility bills which the ALIOs cannot recover VAT on. Is it actually possible to do that? It seems to me we're in a situation where a company or an entity which cannot get VAT back is avoiding paying VAT. Is it possible to do that?
Yep, so we're working with our VAT advisors on this one. All of the ALIOs have what's called VAT leakage, so they are able to recover some of their VAT, but not all of it. The opportunity that we've identified is that we can reduce that leakage and therefore increase the amount they're able to recover for VAT, therefore increasing the amount of money that comes back into the ALIO. So yes, we're working with our VAT advisors on that particular issue.
Thank you. Councillor Watt next.
Thank you, Provost. My question is in relation to 292, 293, 5.2 and 5.3, the Strategic Alliance and the operational measures. I'm lucky enough to live in Auchterarder, and we have ACSR promoting sport and activity and participation in sport in the Auchterarder area, and we have the Auchterarder Community Sports Hub making the facilities available to the public at the Community School of Auchterarder. Now, when Live Active Leisure decided that they were going to pull out of Auchterarder, there were 90 users per month of the facilities. This month so far, there's been 1,234, and the average now is 1,500 users a month. And that's down to one paid employee at ACSR and a whole load of volunteers and 5 staff. I would ask that part of that strategic alliance are user groups and groups like ACSR and the Community Sports Hub. There must be more of them around the county to be a part of that strategic, because it has to be user friendly to get the people in. Thank you.
Thank you for your question, Councillor Watt. I'll take that on board and feed that back into the strategic lines once it's set up. Thank you.
Thank you. Councillor Forbes next.
Thanks. I'm slightly perplexed as to why we needed an external team of consultants to handle this for us. There's nothing in it that I can see that I don't think we could have come to the working group that you've referenced has already set up. So I'm wondering why there was a decision made to go out to external consultants, and if it's practical to share the information in public, what the cost of that consultant was.
Thanks for your question, Councillor Forbes. In terms of the study itself, we did actually go to a recruitment exercise for a project manager on this, and we were unable to appoint. So that did take up a little bit of time at the end of last year in terms of going through that recruitment exercise. One of the things that we wanted to do was actually present members with an independent study, given the amount of time that we have been speaking about different options for ALIOs moving forward in terms of their structure. We wanted to be very clear with the financial data analysis, as well as have the cooperation of our ALIO chief executives. One of the ways to do that was by having an independent study where no one particular party took over more of that study than the other. In terms of costing, I can certainly give you the costings for the consultant, but what I would say is it was considerably less than we would have been if we had recruited for a project manager over a 12-month period.
Thank you. Councillor Lane.
Thanks, Provost, and thanks, Charlene and the team for the work you've done on this. It's been a long time coming from when elected members have asked for this to happen. I'll have a couple of questions. I'll try and roll them in, but when did it become apparent that the NDR issue and the costs related to that became the overarching issue? And could we not then have pivoted to examine the other options that you've mentioned instead of going through the whole lot when the 2.5 million NDR thing was going to be the thing that was going to stop everything? And the recommendations that have come forward now, could they not have been done through the SLA process anyway? We've been asking these ALIOs to work together for years. And now we're going to form this new strategic group. Did we have to do that? We had an officer who was had the SLA in control of them, monitored the SLAs. Surely that would have been the route to do this years ago, rather than having to have sort of quarterly meetings with them. And the final point is, elected members drove this to have a review of the ALIOs, and yet there's not one elected member on the working group. It's senior officers, the chief executives of the ALIOs and consultants. And this was the same what happened when the elected members drove forward for a review of Tayside contracts. They were asking for it, but they're not part of it. And a lot of these elected members were on Tayside contracts. A lot of the elected members also were have been on the boards of the ALIOs through the years. So why were they not part of the solution?
Thank you for your question, Councillor Lang. There was quite a number of points in there. In terms of the elected member involvement, I have been going to SNP leaders. I've been to the Finance and Resources Conveners meeting, the Strategy and Performance Conveners meeting. As part of the engagement exercise that was undertaken by the consultants, they spoke to elected members with particular focus on elected members who sit on the boards of the ALIOs. In terms of the NDR issue and also the staffing cost issue, you're absolutely right that this became apparent. What I would like to point out is that the consultants actually started this work in April of this year. So while this has been an ongoing matter for some time, the actual financial analysis and things didn't start until kind of mid this year. And actually at that point, I think I did speak to elected members about this. Now I think there's been something like a paper every 2 years since around about 2014. The models, the structural models that we have looked at have all been taken from these papers. So what I wanted to do was give elected members a definitive answer in terms of the models that have been set out time and time again. That's not to say there aren't more creative ways of working with ALIOs moving forward. And I think this is what that paper is suggesting. I know that there are SLAs and there are other groups. I think we've made great progress in terms of relationships, collaboration and agreement with our ALIO working group, and I would recommend that we continue working in this way and start to look at different and more creative models moving forward. Thank you.
Thank you. Councillor Peterborough.
Thanks, Provost. I think my questions kind of follow on from Councillor Liz Barrett's and also Councillor Grant Laing's as well. I get that the constraints that the Barclay Review and harmonisation of working terms and conditions place on the structural transformation of the ALIO. So, although kind of disappointed with the conclusions of the review of the report, I kind of have to accept them. What I do find kind of hard to swallow is with regard to the mentions of consolidation of IT systems and I think management posts. And I think when you look at the fact that there are effectively 4 heads of finance across 3 organisations, which all have a pretty small combined turnover, that does seem top heavy to me. And I think the plethora of IT systems surely needs to rationalisation. And the council's got vast experience in terms of consolidating and rationalising IT systems, overcoming user objections to say, well, it doesn't give me 100% of the flexibility or functionality that I used to have with this system. But part of the response to that was, well, you'll just have to suck it up and we'll make the best of the functionality that we can provide. But the savings from rationalising the programme or number of programmes, need to drive that. So what assurance can the Chief Executive give us that the new strategic alliance will together to deliver these sorts of efficiencies as and when vacancies arise or there's staff turnover with the ALIOs? And will there be, because I'm slightly concerned at what this strategic alliance is actually going to consist of. If it's a project based, then the people involved in it could change every 6 months or every 18 months as each project starts or comes to a conclusion. And I think that there needs to be a chief officer forum of some description without creating masses of bureaucracy, because it's already reporting to scrutiny umpteen times as well. But we've seen that an SLA-driven approach didn't really work, and I'm concerned that this new alliance has to actually deliver, and how do we best achieve that?
I can come to the Chief Executive first, and then I'll come to Sharon.
Thank you, Provost. Yeah, just maybe to kick off and pick up some of Charlene's comments. There's been talk about a review of ALIOs since long before I arrived in this council, and I believe there has been a number of previous papers which either didn't kind of materialise at council, but work has been done. I'd commend Charlene in the way that she's led this work. I think her comments about the relationship with ALIOs is definitely better than what we had a number of years ago. I would absolutely suggest to you and anybody else that we were keen to look at this giving us an answer which was sustainable in the long term. And I think some people thought that we were wed to the idea that we were looking to bring everything in-house. Bringing everything in-house is an option for the council, but it will cost you roughly a couple of £1 million if that's what we want to do. Other councils have chosen to do that recently. I think Falkirk most recently, and took a hit of just over £1 million a year. But given the financial position, the recommendation officers is to look at what best we've got. There is a responsibility on the ALIOs. We have challenged the ALIOs directly about the appointment of some posts over the period of this review, last 2 years. The ALIOs chose not at those times to take on that advice, because it was only advice. And there is a responsibility, I think, for members on those bodies, reflecting that they do have different responsibilities as directors on those bodies as well. But those decisions about not filling posts in the past have been decisions that the Alios have made themselves. We encouraged them not to do that, particularly when 3 finance posts have changed over the last couple of years. We'll continue to do that, and I think the strategic partnerships offers us the opportunity to look to formalise that much more strongly. And that's something that we would require members of all the boards to support, because that would have to be endorsed by the 3 Alios themselves. We will, as officers, continue to work as best we can with the Alios. And if council is minded to maintain the same levels of service, and certain things you can see in the ECOS report will require continuing levels of public subsidy. Many of the services are not going to break even financially. Many of the services are social services, not just about the financial return. And that will be part of the balance. We will bring you again to council, because council decided 2 years ago to put significant additional investment into library services for 2 years. We will need to consider that again, alongside the challenges we have around about health and social care and tackling poverty. But officers will continue to work through this model, and we'll work with colleagues in the Alios. And your final comment, Councillor Barrett, about the use of scrutiny. I have attended a number of scrutiny sessions with Alios. Quite often it's a presentation of what they do, things that are on. There maybe needs to be a look at what we bring to the scrutiny panels in terms of the type of focus within scrutiny, because I don't need the Alios to come and just tell us what they've been doing over the last 3 months. I don't think that adds a particular benefit to council, and I'd encourage that to happen.
Charlene, do you wish to add anything at all? No, thank you. Okay. Councillor Collins, you're next, please.
Thanks, Provost. So a few questions, I think. The original December, sorry, not close enough. The original December 23 recommendations, could you remind me what they arose out of? Was that also from an external consultant?
Thank you for your question, Councillor Stewart. I wasn't involved with the Alios at that point in time. My understanding from watching back and reading all the papers is that there was an independent review to look at governance and financial matters within the Alios, as well as audit, and that was carried out by Glasgow Audit as an independent study. And from there, I think we had around about 22, 23 recommendations, all of which are set out in Appendix 1 with progress reports, or whether or not they've been concluded, completed, or are ongoing in terms of action.
Okay, thanks. It was Glasgow Audit that was in my head, so that thank you for that. The point of being that for the question that I was initially going to ask was in terms of recommendation 3, that wish to point there should be an PKC could potentially provide internal auditors for each of the Alios. And then I noticed that that has been concluded by not doing that, and it being noted that external audits are carried out in relation to the Alios. So I was going to ask what that cost. But then as I proceeded through Appendix 1, what I'm finding out is that a substantial number of the recommendations from the original Alios review either haven't been done, or it's proposed that they not be done as a consequence of this Alio review. So we've paid somebody to provide us with recommendations back in December 2023, and we've paid somebody else this year to provide us with different recommendations. And I was just wondering why we would rely on the ECOS rather than the original Glasgow suggestions, a lot of which were to do with the consolidation, not just of IT systems, of finance systems, of certain posts within and other back office functions. If that's not, have we just wasted money by not implementing original recommendations and now getting somebody to tell us that those original recommendations wouldn't work?
So essentially, in terms of Appendix 1 and all of the actions that are there, you're absolutely right in that there are a number that have been concluded as a result of either work that's been ongoing. So for example, if we take Action 3, which was around an internal audit management and appointing an internal auditor. Well, actually, I think our internal audit team is such that actually we don't have the capacity and the resources to appoint an internal auditor specifically for each ALIO moving forward. But there are absolutely audits internally undertaken in ALIOs, and they also have external audits as well. So that has been concluded, but that work is ongoing and has been done. In terms of some of the other points that you're making, you're absolutely right in that actually some of them have been concluded. The main recommendation from the council report back in 2023 was the consolidation of corporate services into Perth and Kinross Council, and we extended that recommendation to look at different structural models as a result of previous papers that had been put up and had highlighted a number of different structures. So while we were looking into one, it seemed only right that we would then consider different models that had also been put on the table at previous dates. And actually a number of the actions here have had either kind of had implications as part of that structural change or knock-on effects and have been concluded as a result of that.
Okay, thanks. I mean, on the point about the audits, whether that function is, whether that is an extra internal auditor here, or whether it's internal audits being conducted by the ALIOs or them paying for external audits, the council is still paying for it at some point along the line. But on the point about the scrutiny, when and the consolidation, when we get the ALIOs along to Scrutiny and Performance Committee, we have asked them repeatedly about their consolidation of functions and their cooperation between the different bodies and also with the council. And sometimes that has required a bit of extra direction from the council. We've been. The impression that I think that members have been left with is that there is a lot of consolidation and cooperation happening. But it would seem that from distilling and interpreting the results of or what's in this paper and the results of the ECOS appraisal, that there is less of it, that less of it has been happening than perhaps we would have liked. Would that be a fair or an unfair characterization?
I suppose I can only speak about my experience in terms of leading this review, and there has been good collaboration. I understand, as our Chief Executive has said, there have been requests in the past that haven't been met, and I would hope to rectify some of that moving forward. I think there is a better understanding between the Council and ALIOs in terms of what's expected and some of the challenges that we face in future moving forward.
Thanks. And last question. Thank you for your indulgence, Provost. It's all in relation to the financial analysis on option 4, which is at 5.2.7 on page 368 of our papers, or page 63 of the appraisal. It looks to me like and thank you as well for the briefing that we got on Monday morning. So you've had advanced notice of this question. It looks to me like most of the costs in terms of option 4, which is a merger of a culture and sport alio and a review of the Perth Theatre and Concert Hall status, but as a separate organisation. It looks like most of the costs come from the merger of the culture and sport alios, which would be £560,000. If we subtracted that from the total cost saving to PKC, would actually be roughly £280,000 to the good, which would make this the best of all the options, but it wasn't considered as a separate option to leave LAL and Culture Perth and Kinross as they are, and then explore further the change to Perth Theatre and Concert Hall. So I wonder whether one of the tasks of either the working group or the strategic alliance could be to further examine the change in status of Perth Theatre and Concert Hall to see whether we could realise that actual financial saving.
Again, thank you. And absolutely, I think there are a number of options that have been brought forward as part of the briefing session or out with that we could certainly consider moving forward and come back to Council with the report on that.
Thank you very much.
Thank you. Councillor Lane with the final question.
Thanks again, Provost. Just to go back to the Chief Executive's comment about the libraries, and it wasn't just 2 years, it's 3 years that extra funding we put in for the libraries. We're 20 months through that 36-month phase, and I'm concerned that, speaking to people who use the libraries and others, that I'm not seeing much movement on that. So can MD give me an update of where we are moving with that? Because by this time next year, we'll have, if we are going to be taking libraries back in-house, it'll have to be done before then. Or where we're going, are we going to be elected members with all the difficult choices we're going to have to make, not just this February, but next February? Where is the library solution?
Okay, thank you. Serge Maroon.
Yes, thank you for your question, Councillor Lane. Following the council decision to allocate funding to maintain the library services at the last budget, was the extra 500k per year. So we are in the first year. This year there will be another year next year. But we have worked with Culture PK to carry out the review of the library services, and we have delivered engagement sessions, particularly with the rural libraries, which were part of the discussion. So these sessions have happened, and we are now collecting all the information to be analysed and feedback into the process in the council, and that will be either to the full council or also the Housing and Social Wellbeing Committee, which is effectively responsible for libraries in line with the scheme of administration for the council.
Provost, can I come back on that? Obviously, I'm getting mistaken. I know we put money in this budget for a review of the libraries, but I thought we did that the previous year. That's why we did it 1 year's funding. Nothing was done within the year, and then we had to put in 2 years funding this year.
That is my recollection.
Am I correct?
Is my recollection.
Strategic lead. You might want
I'm getting nods to my left as well, so I think that is correct, yes.
Could you correct that for the record, please?
Well, I think it's been corrected, so yes. I have a point of clarification. No, and we've sorted that. Wonderful. Okay, thank you, Serge. I'm now going to come to the Leader of the Council to move the report.
Thank you, Provost. I am pleased to move the motion for the Council to consider and approve the recommendations within the ALIO's options appraisal review papers before us today. As members will be aware, this review has been a significant undertaking initiated as part of our wider transformation and change programme. The purpose has been clear: to ensure that our arm's length external organisations, Culture Perth and Kinross, Live Active Leisure and Perth Theatre and Concert Hall, are best placed to deliver high quality, sustainable leisure, culture and theatre services for the people of Perth and Kinross and beyond, both now and into the future. The review has been independently led by external consultants and supported by a dedicated working group, has involved extensive engagement, data analysis, and options appraisal and structures. I want to thank all those who contributed, including our ALIO partners and council officers, for their commitment and openness throughout this process. The recommendations before you are the result of careful consideration of the evidence and options. Notably, no alternative structural model was found to be more effective or viable than our current arrangements. However, the review has identified clear opportunities for improvement, particularly in strengthening collaboration, operational efficiency, and shared services across our ALIOs and with the council itself. This work is already underway in a number of areas and will continue to be progressed and reported on regularly. The establishment of a strategic alliance between Perth and Kinross Council, Culture Perth and Kinross, Live Active Leisure and Perth Theatre and Concert Hall will allow us to continue the good progress of the working group in this area and look at driving forward operational matters, shared service opportunities and improved collaboration. This will ensure that we continue to focus on our communities, their needs in these areas, all linked to health and well-being, and keep on delivering best value and a high standard of service. I look forward to being involved in and hearing about progress of the Alliance in the near future and agree that following approval today, formal terms of reference, including composition of the membership of the Strategic Alliance, formal terms of reference along with purpose, aims and timescales will be brought back to Council for final sign-off. This approach aligns with our corporate plan and transformation strategy, supporting our vision of a fairer, more prosperous and sustainable Perth and Kinross. It also ensures robust governance, financial oversight and accountability for the services our ALIOs provide. In conclusion, I commend the recommendations to Council and move the motion as set out in the papers, and I look forward to members' support and working together to deliver the best possible outcomes for our communities. Thank you.
Thank you. Councillor Rebeck, second, please.
Thank you, Provost. I think a couple of brief observations just before I formally second the paper, because there has been a lot of chat about ALIOs over the years, certainly as long as I've been an elected member, but we are where we are, and I think the work that Charlie and Norman have done over the last few months does get us to a point where we can move forward from this point, I believe, and I thank both of them for that. And I think we also have to remember that art and culture and sport play an important part of people's lives in terms of their health and well-being. And if that requires some degree of public subsidy, I'm all right with that, personally. However, we do have to also remember that budgets are constrained, and therefore we have to deliver these services in an efficient and appropriate way. I do believe that this paper is just the start of the journey. I genuinely believe that. And I do think our ALIOs have been at the heart of delivering art and culture and sport and libraries and drama and theatre and music over the years, and notwithstanding legitimate concerns raised here today, they have by and large delivered them pretty well, I believe, and they're important to the people of Perth and Kinross. And the ALIOs will be at the heart of whatever we do for a number of years going forward. I do think the Strategic Alliance brings forward that old chestnut about strategy and operation. And I do think that the strategic objectives of that alliance should be set by Council. It will be set by elected members here, and they should be set specific strategic objectives and be accountable to the outcomes of those. I think that that's really important. However, it's also important to recognise that once we have set those strategic objectives, how they're delivered is operational, and it should be down to the people that know how to do that best, and those are our ALIOs. So, however, you know,
I think we are where we are. Let's move forward, and I'm happy to second this paper.
Thank you very much, Councillor Rebeck. Bailey Brock, the first comment.
Thank you, Provost. I welcome most of these recommendations in the report, particularly the formation of the new strategic alliance. And I hope that this can realise significant long-term benefits for our Alios. I would like to say briefly about libraries, because I know that in my own ward, there is significant concern about the potential closure of Comrie Library. They're not alone in this, and we saw earlier this year that communities across Perth and Kinross are strongly opposed to the potential closure of rural libraries. However, I'm concerned that given libraries generate very limited income compared with other parts of our Alio estate, they're always going to be at risk of cuts as our Alios work within a tighter fiscal envelope. However, our libraries provide a vital service within our communities and help deliver on a wide range of council priorities, including many that were discussed in earlier papers. Libraries make a huge difference to improving literacy, reducing social isolation, and helping support people back into employment. I'm aware that there is currently a library service review working group looking into the future of the rural libraries that were previously slated for closure until Council approved additional funding for 2 years to allow further review of the operating model. I would like to ask the leader if he would agree that as part of the options being undertaken by the working group, that some further work be undertaken around the option to bring libraries back in-house. In particular, some more detailed work around the non-domestic rates position and whether there might be opportunities to apply NDR relief currently applied to libraries to other parts of the growing Alio estate. Also, where strategically libraries might best fit given their wider impact on equalities, education and council priorities. I hope the leader will consider supporting this so that councillors are presented with more detailed information on all options when they consider the future of libraries in early 2026. Thank you, Provost.
Thank you, Bailey Brock. Councillor Donaldson next, please.
Thank you, Provost. Can I just say, following on from Bailey Brock, I think the council leader's going to make a comment in a minute. But in fact, after one or two initial hiccups on Comrie Library, the actual review process has actually proceeded more recently quite well. Could I say, I know a number of members of council may well be disappointed by this report. I actually welcome it, and the reason is 8 years ago when I was elected to this council, this is an ongoing subject, and I've almost felt at times we've been going round and round in ever decreasing circles on this whole issue of the Alios in the future. And I think that's all, amongst other things, has been bad for staff morale in the Alios. I can remember at the end of 2019 being asked to join the board of Horsecross, the now Perth Theatre and Concert Hall. I didn't particularly wish to do that, but I felt it was right. And at that time, Horsecross was, in effect, not far from being insolvent because of the whole position on advanced ticket sales. And that, in due course, led to the Glasgow audit report, and really very powerful report indeed. And that then in due course has led to this review. I welcome this review. It may have taken quite a bit of time, but it's thorough, it's comprehensive, it's very detailed, and I think it lays to rest a number of the concerns members should have. I think the key factor is on non-domestic rates. I think there has been this belief by some that if you create a super Alio or you bring a whole lot of services in-house, you end up with economies of scale. I've always taken the view that, in fact, the danger is you end up with diseconomies of scale. I welcome the strategic alliance. I think obviously councillors, not just scrutiny and performance, but overall are going to monitor exactly how that works out and what the partnership arrangements are. Looking at Appendix 1, and just to conclude, the one area I do think is actually going to be really important is on IT. Now, we've got just now that is complete, the review of the ICT arrangements across the ALIOs. But then it states the ALIO working group can continue to monitor this and ensure that any proposed changes are considered in terms of efficiency and shared services. I think it's important, not just with the computer systems and IT of the individual ALIOs, and they all have differing requirements and needs. It's not just the compatibility between the ALIOs and the council, although that's of importance. It's also the compatibility as far as we can achieve it and the linkage between the different ALIOs. And that may well create greater efficiencies, but what the costs are the IT systems of each of the ALIOs actually fit for purpose? I think that is something that's going to have to be looked at. But in general, I welcome this report. Thank you.
Thank you, Councillor Donaldson. Councillor Lane next, please.
Thanks again, Provost. I'm afraid that I disagree with most of what my friend Councillor Donaldson said there, and also with a lot of what the Leader of the Council said. I'm disappointed with the report, not because of the work put in by Charlene and Norman and all the others. They've done a really good job of putting work together. It's the result of I was on the board of Live Active Leisure for about 8-9 years. Been here 13 years. We've talked about it. We've had almost insolvencies, council having to bail out things. And all through that time, there's been divergence between the way that the three ALIOs operate. These systems should have been integrated 10 years ago and moving forward through the monitoring officer of the SLAs. That should have been part and parcel of it. It's the letting divergence which is built in to get to the point now where we can't bring everything back together. So I'm looking forward to the strategic committee that's put up. But I think we're overpraising it. It's not met yet. It's not been set up. It's got on, but we're hearing from the Leader of the Council and Councillor Donaldson how great it's going to be. I'm afraid there's been a lot of talk for years about bringing the ALIOs together with the monitor officer and delivering services together. I think to praise it to such high esteem at the moment with no results announced up is a bit premature. So thank you.
Thank you, Councillor Lane. Councillor Allen next, please.
Thank you, Provost. I'd like to thank Charlene and the team for the report. I would then like to go on and fully support and commend the comments of Bailey Brock with regards to the position of the libraries. We heard earlier today about the health and wellbeing shortcomings as our population age. Many of our senior citizens and our senior community enjoy visiting and spending time in the library. Auchterarder Library is a well-used and increasingly more so nowadays community asset, and we cannot lose this. We worked across the political divide last budget session to save our libraries. I would like to repeat the request to consider bringing our libraries back into the council. Thank you.
Thank you, Councillor Allen. Councillor Collins Stewart next, please.
Thank you, Provost. My thanks also to the strategic lead for projects and programmes and her team for the work that's gone into producing this. I think there's a valuable piece of work here. I really hope that this new direction under the Strategic Alliance is successful, because I think the current position as represented by the appraisal is disappointing. When we look at the Appendix 1 there, the one that I was asking most of my questions about, in terms of the alignment that we had expected to have happened already, by the ALIOs in terms of payroll, those back office functions, and various of their IT systems. I think it's disappointing that that hasn't happened. And I think there's a missed opportunity here as well, in that instead of just saying, okay, well, it's too difficult to do, the actual task should have been to find a way to leap over those barriers rather than let them stand in our way with and hear a sort of computer says no response in terms of can we do something. I think there's a lot more that could be done with the input of transformational programs or techniques, and I would look forward to the Strategic Alliance trying to force some of that work through. I do want to ally myself, like Councillor Allen, with Bailey Brock's comments on the value of libraries, and a question did come up about how far advanced that the library review has been this year. I think it was Councillor Lane that had asked the question. Like Councillor Donaldson, I think that maybe some of the planning and activity around that had been slow to begin with, but I've got 2 meetings this week of friends of groups, because my ward is affected with 2 of the proposed closures, Alyth and Scone libraries. I've got 2 meetings this week. The collaboration between Culture, Perth and Kinross and the local friends groups is really paying dividends. The action plans that are coming forward to increase footfall, increase usage, increase the social value of the libraries are really going to pay dividends. They're already paying dividends. I asked last night at Scone about increased membership. There's already increased membership and footfall at the libraries. There are more activities taking place, and there's the opportunity for a far broader programme of activities and usage of the libraries by our communities and community groups, and for them to deliver even more social value, the exact social value that and well-being value that Bailey Brock was talking about. And I'm looking forward to just how exciting those programmes could be and how much use we could get out of assets which are physical assets, but are far more than that. They are social assets within each of those communities. Thank you.
Thank you, Councillor Stewart. Councillor Massey next, please.
Thank you, Provost, and thank you for the report. While I appreciate the considerable effort that has gone into this report and the thoroughness of the options appraisal, I remain concerned that the Strategic Alliance proposals may not go far enough to address the deep-rooted challenges faced by our allies. The report identifies that structural change would be costly and complex, but also highlights persistent inefficiencies, financial pressures and governance inconsistencies that cannot be overlooked. The Strategic Alliance is presented as a compromise, and while I support the principle of enhanced cooperation, I'm cautious about whether this model will deliver the scale of reform required. Coordination alone is not enough. We need to see clear improvements in governance, transparency and value for money. We need real progress on shared procurement arrangements to reduce costs, particularly in areas like utilities and IT systems. We need a more consistent approach to financial reporting and risk management across all ALIOs on performance and pressures. We also need to see meaningful workforce planning that addresses duplication in back office functions and explores opportunities for shared staffing where appropriate. I support the direction of travel, but I believe we must remain alert and ambitious. This is an opportunity to reshape how we deliver our vital cultural and leisure services across Perth and Kinross, and we cannot afford to let it become a missed opportunity for reform. Thank you, Provost.
Thank you, Councillor Massey. Councillor Harvey next, please.
Thank you, Provost, and I hope you can hear me. I just want to reflect what Councillor Donaldson in particular and Councillor Massey said as well. I actually welcome this report. I think it meets the terms of reference of what was asked for, and it's a very robust analysis of it. However, let's follow up on Councillor Massey's stealing my thunder there. I think the strategic alliance going forward needs to be not just a talking shop, but something that actually delivers. But other than that, I welcome this report. Thank you very much.
Thank you very much, Councillor Harvey. Councillor McCall next, please.
Thank you, Provost, and thank you, Charlene, for the report. I have a couple of, well, related comments, if you wish. I think, first of all, I'm not quite as pessimistic as Councillor Donaldson regarding IT. I think that there are many models out there where you can have IT alignment, providing you put in the right infrastructure and you put in the right interfaces to enable IT systems to work collaborative with each other. It may take some time, but it's not impossible. And I'm hoping that our head of legal here will remember the time when e-procurement Scotland was introduced, and that very thing had to be done across all local authorities, health board, public sector organisations, so they could all work with one single solution. So it's not impossible. It may take a bit of time, but I think that needs to be seriously considered. Not only would it be good for the individual ALIOs and for the council, but it would be good for the tourism offering, in fact, for Perth and Kinross as a whole. Regarding the Strategic Alliance Board, I think that it's a step forward, but I don't think it should be a coordinating forum. I think it should be a board, like a project board, that has some oversight and be able to offer direction to any initiatives that are being coming forward. Otherwise, it's in danger of just being a little bit of a talking shop, as somebody said already. But nevertheless, I think this is at least some structure and some clear direction of a way forward, and I welcome it, and I thank you for your work that you've done in this, and good luck.
Thank you, Councillor McCall. Councillor Duff, please.
Thank you, Provost. I'll try and keep my comments relatively brief. I welcome the report as a sign of progress in resolving the ongoing issues around the ALIOs. I likewise hope that the Leader of the Council will examine further the issue of library facilities as part of this work. And finally, I think Charlene stated that the Strategic Alliance would report annually to Council. I would like to see a bit more regular updates on the Alliance's work with our allies, so that we can have confidence that we're making the much needed progress in this area. Thank you.
Thank you, Councillor Duff. I'm seeing no further comments, so I'll come to the Leader of the Council for summation.
Thank you, Provost. I've listened carefully to the comments led by Bailey Brock, and I'm very happy to incorporate the additional work that she has suggested and recommended as part of this overall piece of work on ALIOs. Indeed, on Monday coming, I will be receiving a report on the ongoing libraries review that has been long awaited, and I look forward to that being disseminated to elected members as soon as appropriate thereafter. I note the comments made by Councillor Lane, Councillor Massey, Councillor Harvey, Councillor McCall about a degree of concern that the Strategic Alliance Board may or may not deliver what we all want it to. What I will say in particular is that I will do my very best to ensure, and Councillor Rebeck will be driving this forward with me. I will do what I can to ensure that we do now make progress in changing the model and optimising the model that we deliver these services through, as this has proved elusive over a number of years and a number of administrations. And I will do my best to change that and to take things forward under the new Strategic Alliance Board.
Thank you, Mr. Leader. Are we all happy to agree the report? Thank you. Members, item 10 is committee timetable of meetings 2026 and 2027, and Scott Henry, the Democratic Services Manager, is just going to provide a brief summary of the proposed timetables.
Thank you, Provost. Members will recall that the timetables were deferred from the last meeting of the Council on the 10th of December, and this is to allow further feedback from some elected members. The timetables in front of you follow this year's and previous year's scheduling of committee meetings on Mondays and Wednesdays at members' request as part of work-life balance. It also includes an indicative timetable of dates up until the next local government elections in May 2027. Whilst it's not for the Council to agree further dates, as these are up to the respective boards and committees, this version of the timetable for next year has taken account of the current proposed dates for the Health and Social Care Integration Joint Board, as well as the Audit and Performance Committee of the IGB, and also the Tayside Contracts Joint Committee and the Tayside Valuation Joint Board. And it is hoped to be able to circulate a full version of the timetable that includes those dates as well in due course. Happy to take any questions.
Thank you. Councillor Liz Barrett.
Thank you, Provost, and thank you, Scott, for taking account of the representations about the previous version of the timetable. Could I please just ask that committee services use CMIS to get this into all of our diaries as soon as possible? We did it that way a couple of years ago, and it's much more efficient than expecting councillor support to do it on an individual basis. Thank you.
Yes, happy to provide you an update to members as to how we do that. Yeah.
Thank you. Councillor Bob Braun.
Yeah, thanks, Provost. Just a couple of things. In December, we've got the LRB coming the following Monday, right after planning and placemaking. And I appreciate we've got Christmas recess, so it makes it difficult to manoeuvre there. But in the draft timetable, we're repeating the same thing in February. Planning and placemaking on the Wednesday and the following Monday LRB. Could we not move that LRB back? There is some space further on.
Yeah, happy to have a look at that and see if we can time that, because I know that the paperwork in terms of LRB and planning, it is quite time consuming. I think it was possibly move some other meetings around to accommodate, but we'll have a look at that.
Thank you. Councillor Alan Watt.
As you'll see, I think licensing committee, planning and placemaking, and I think the local review body, due to the volume of business, has to kind of to meet as I think it's a monthly or every 6 weeks. So yes, we would be delightful to avoid any meetings in the recess, not just for elected members, but for our staff and our team as well. But I think due to the volume of business, we would be probably asking you to start meeting on a Saturday, which I doubt would go down very well.
Bailey McLaren.
Thank you. Just sort of continuing on from what Councillor Braun has said there about planning, placemaking and LRB. I was feeling that there might be a pinch point December into January for all officers involved in the planning and organisation in LRB, because there is a meeting, as Bob has picked up, the 16th, LRB the 21st, and then just back from recess, the 6th of January. So I would question the closeness of those three meetings, not just the three.
The consultation, the timetable included the colleagues and plannings, but we're happy to speak to them just to make sure that is achievable.
Okay, thank you very much. I don't see any further questions, so are members happy to agree those timetables? Thank you. Members, item 11 is the appointments to committees and outside bodies, and this morning you were in receipt of an updated list of appointments. Are we happy to agree the revised list that was circulated this morning? Agreed. Thank you. Members, item 12 is elected member briefing notes. Are members happy to note the elected member briefing notes that have been issued since the last council meeting of the 10th of September 2025 as on the agenda? Noted. Thank you very much. Members, that concludes today's formal business. Thank you.